Well, here we are. Webinar number 11. Time does fly when you're having fun. Thank you everyone for joining in today. We have managing your thorax issues for your patients is our webinar title. Maybe not the flashiest of titles, but man, over the last couple of years has this become a really important part of my practice. Kind of used to be that computer work was the reason why we would spend so much time on the mid back and the thoracic spine. But as kids get their phones earlier and we get more like this, it just seems like there's so many conditions that we're dealing with that are mid back related, whether it's neck or shoulder or low back, hip. We always kind of end up with the mid back and trying to create some correction there. So an exciting topic today as we dive into different ways you can think about treating your patients through the thorax. And then as always, we'll jump into our Q&A at the very end. So let's get rolling here. As always, our mission statement here is to provide you the streamlined kinesiology tape solutions that you need for your patients, to provide you the highest quality product so that quality is portrayed to your patients and they see you with the same quality that you deserve for making the right choice and including Spidertech in your toolbox. As I mentioned before, certainly I spend a lot more time taping the mid-back, the thoracic spine, the thorax in practice. A combination of, as I mentioned, people are getting on their phones earlier like this, we're on the computer. There's more awareness, certainly my awareness of lymphatic issues and trying to optimize that has taken me more into taping through the mid-back, and we'll go dive into that a little bit today. But it's always been the case is that my experiences in golf and tennis and all very rotational sports, and much of rotation comes from the mid-back to make sure that we're optimizing the range of motion and mobility that these athletes need. And so I've always had a big interest and demanded that I was very good at treating the thorax, and that has worked out quite well with the postures that have seemed to be coming in day out in the clinic as well. All right, our webinar goals. We're going to keep it nice and simple as usual. We're going to figure out how we can tape to include or improve thorax function, and then we're going to take a little bit of a different approach to showing the tape. I think after each idea each way that we talk about how we can help the thorax, we're going to look at a video right afterwards and give you some ideas as to how you can help tape that yourself. Okay, so our advantages to using our ProCut solutions, they all come ready for you to apply to your patients. As you know, everyone here loves Spidertech, and so this isn't anything new, but the standardization, the fact that they're machine cut, the fact that it's highest quality, the fact that they're made here in Canada with all North American products, the fact that we have the standards that you want in your medical products, and the fact that you can put them on anywhere in a time-saving way, make it the best kinesiology tape out there. It's the reason why I got involved with Spidertech, and it's the reason why I love it today. But let's dive into our subgroups. So these are going to be the patients that we're considering when we look at how we can help through the mid-back and thorax. I think the classic one is going to be helping someone with their posture. I mean, that's something that we do many times throughout the day. The second one is how can we tape to help some rib function? How can we decrease some pain, improve some mobility through the ribs? One that I have personally probably spent the least time with has been how we can help with breathing mechanics, but we'll dive into what the research says about that and give you some ideas as to optimizing the function, maybe some diaphragmatic breathing, but also when it comes to helping some patients who might have pathology that's affecting breath, something like COPD or any kind of obstructive lung issues. And then we'll dive into some spinal pain, just keep it real simple as to how tape can help with pain through the thorax. And then lastly, we'll look at how we can help our lymphatic issues. Commonly that would be from some sort of people who have had issues with their lymph nodes being removed, gone through some cancer therapy, things like that, or it can just be some congestion through the lymphatic system that we're trying to just kind of optimize things and get them flowing as well as possible. So we'll dive into that lastly, which is also a pretty exciting topic if we're talking about optimizing where we are or where your patients are in their life. All right, diving right in. So our first topic that we mentioned was going to be our posture. I mean, this is going to be the one where we're just helping someone who's slumped forward for the most part. We're kind of getting away from our text neck, our rounding of our shoulders. And the cool thing about all the research that we'll go over today is there's just been a massive boom in the amount of research on kinesiology tape recently. And so we can now, I mean, we're not going too far back in the literature to pull out some great studies that show some positive results. And so everything is very recent. And we're always constantly able to show some new content, some new information, giving you ideas as to how you can help your patients. But as we dive in here, with this study, it is an 8-week study. We see this is how that they taped for the first 6 weeks of the study. We used 50% tension, easy peasy. The idea was that we're trying to get your patient away from a rounded shoulder posture. And so what did we find? So in this study, they combined a pec minor stretch with the tape, and they did that for 6 weeks, took the tape off, and then they reevaluated after 2 more weeks to see are the results lasting. And we looked at both the rounded shoulder posture. We also looked at the mobility of the ribs, and we looked at also the strength of our respiratory muscles, so primarily through the diaphragm. So some cool results here. We see that if we do nothing but stretch, which is the control group, after 6 weeks we see a 9% improvement, which is fantastic. If you want to decrease your rounded shoulder posture, I think a stretching program that are going to affect the pecs is going to be a great way to attack that. And then we see that after 8 weeks of losing that stretching program, it goes back to about a 2% improvement, but there's still some improvement. If you included tape with your stretching program, now we're starting to see some big numbers. We see some 28% improvement in the rounded shoulder posture, so the ability to maintain this position. And I will say that at the 6 weeks, the tape was removed, and then they evaluated. And then in a kind of an encouraging way, after 2 weeks of not using the tape, not stretching, we see a 21% improvement maintained through those participants in the study. We also see there's a big improvement in their chest expansion, the ability for the ribs to expand when we're with respiration. Those improvements maintained throughout, even after 2 weeks. And then interestingly, the respiratory volume, the respiratory pressure, the strength of the diaphragm improved by 12% after the 6 weeks, and then even continued to improve after 2 weeks of doing nothing. We can only extrapolate that that's going to be just from the improved posture. And then as you continue to breathe with improved posture, but improved positions, and all of a sudden the diaphragm gets stronger and stronger with every breath. And even with the tape on, without the stretching, we see the continued to improvement. So this will be something that I think, I mean, if you kind of believe what I just said here, you believe the study, I don't believe it to be flawed. I think that this is something that we can help a ton of your patients with. It's really simple. I'll use the posture spider for this one all day, every day. I'll put it on multiple times throughout the day with patients. As a result, the conclusion is being that the functional correction technique, which is they use 50% tension over 6 weeks, can diminish forward shoulder posture with the effect of treatment being retained for 2 weeks even without the tape. The intervention effect also showed respiratory improvement, including strengthening the inspiratory muscles and expanding the upper, middle, and lower chest region. So all fantastic. And the things that you would expect, right? If you improve the posture, you're improving respiration, you're improving lung function, but also rib function, and all of a sudden we're just optimizing, getting back to where we normally should be. All right, so We'll dive into a video here where we show how to apply the posture spider. I think this is the gold standard in achieving the results that I just mentioned. Really simple. And when we apply this one, I think and we'll kind of just have the video running as we kind of chat through it, but I think the benefit being here is that, and the reason I've been so successful with it, is that this does not impact or get in the way of normal function. You can still play your sport with this. You can still go to the gym with this. You can still do anything that you normally would do, except you're doing it with this posture spider on and or posture pro cut on, and you're improving your function of your mid back. You're improving the function of your low back, shoulders, neck. And so if you compare this to like a posture brace, then that is something that you are kind of, maybe you wear that at home, maybe you wear that like when, because it's a bigger, bulkier thing, you can't compete. Where I've had golfers compete with this on the golf course, I've had tennis players compete with this on the court. I've had people go to you want to go to the gym with this because now you're in a better position, so you want to strengthen in those better positions. Even just using this and then doing working muscle groups that surround it, now we're doing it in a better posture. And so it's something that you can wear all day, every day, 24 hours a day, and it's going to be creating improvements. And so I think it is your gold standard, your go-to move for someone who has any kind of extra kyphosis in their T-spine, anyone that has any kind of rounded shoulder posture. This is where I would start. All right. Okay. Excellent. So we dive into the next study, which is looking at a rib fracture. And again, another recent study, and we're looking with the rib fracture. We're looking at really the pain benefits with this. And so if we come here, we see how they taped for this fracture. They essentially just put a tape around where the fracture was. This makes total sense. I would say that if I was to tape for rib dysfunction, someone who has a rib irritated and it's painful, I would kind of tape in the same way. I would probably also maybe tape up the attachment at the spine as well, kind of that kind of superior to inferior up the joint as well. But I would certainly move around the rib cage just as you see here. And so this would kind of expand not just for the fracture, but also would be something you'd use for someone who has rib irritation. So what do we see with this study? And the interesting thing about this one is that they kept it small, and they had them wear the tape for a day. Sorry, they had the tape off for a day. They put the tape on for a day, off for a day, and off for a day. So they had the same people that were having tape put it on and off, and then they would report their pain in different positions and different times of the day, doing different things. And so, as you can see here, if you go back to the previous slide, every day, which is 2 and 4 that we have tape on, we see significantly decreased pain scores that is measured by a visual analog scale. At rest, during deep breathing, while moving, and then in terms of the greatest and least pain they see in the day, we're seeing significantly lower pain levels each one of those categories on the days where they were wearing tape versus not wearing tape. And so the fact that these were the same people reporting this, I think, is an interesting way to interpret that data, or like to think that this is a reliable source, I would say, because we're dealing with the same people reporting the same levels, the same type of rib fractures. And then if we dive into the conclusion here, we see that this study, although it was a small number of people, they found that kinesiology tape has the potential to reduce pain for patients with fractured ribs. And then we kind of go into, at the very end here, that the improvements, well, yes, exactly. So we see that this essentially is showing that we had a small study dealing with rib fracture people, but everyone who was in the study saw benefits on days where tape was included. And so if we dive into the thoughts of how we would tape for this, this would be one, like the video we see here is going to be if we're dealing with inflammation, if we're dealing with bruising, if we're dealing with something from a fractured rib, this would be the way that I would tape to get rid of that fluid in the fastest possible way. We would use our fan. In this case, it is our small fan, and in this case, it is done with the kind of a crisscross method here. And the benefit of crossing over one another is that you can imagine that knowing that the secret to the tape is the lift up of the skin, is that if we go tape over top of tape, we're getting greater lift, and that greater lift provides even more space for the bruising, the inflammation, the swelling to flow out of the area. If we're dealing with more of a rib irritation, this is probably where I'm going to go. My preference would probably be take a hip spider, start it at the spine, and wrap it along the length of the rib, so kind of like wrapping it around the front of to the attachment at the sternum, and then I would also do one at the attachment at the spine, running kind of top to bottom, getting over top of the erector and improving kind of the tension and pain through there. And so those would be the two thoughts I would have. This one on the video, better for decreasing fluid. It probably isn't going to last quite as long just because the strips are smaller, it's a little more fragile. For someone who just has an irritated rib, for someone who has pain through there, I'm going to go with the bigger strips. Cover more surface area and wrap it around the length of the rib itself. Okay. So if we dive into that kind of concludes our thoughts for our rib irritation, our rib fracture. We're now going to dive into our next piece, which was how the tape can affect breathing, both from a pathological standpoint. Here we see with someone like COPD in this study, but we can also kind of take those thoughts into how someone can optimize breathing in terms of just getting some diaphragmatic breathing involved, getting the breath out of the chest, dealing with helping people kind of get it out of up and through the neck and the shoulders, which we see so often with people with neck pain and with headaches and who are stressed and all kind of those pieces. But another recent study here. This one, with our COPD patients, they taped in two different ways, and they used a number of a bunch of lung function objective measures. They also use ability to use exercise. They use a 6-minute walk as their ability to do exercise. And the length of the study was a 15-day study, and when they evaluated the improvements. Of interest, they used two different methods. One method was designed to affect the diaphragm, and one method was designed to affect the intercostals. What I would anticipate the results to be is exactly what they found, is that both the taping that they used, whether it's kind of starting from the sternum and moving around, or starting from the spine and moving the opposite direction. So both from the diaphragm, they kind of moved out here. From the spinal and intercostal, one version they kind of started the spine and moved around. It didn't matter. Both groups saw the same level of good improvements. And so from that standpoint, that kind of fits my bias. I think the thing to consider when you are taping your patients, in this case, is I would tape the area that is tense. I would tape the area that you feel is there's constriction, or that is stressed, or that you want to kind of highlight for your patient. and then go from there. And I think that's where you're going to get the best results. You know your patient the best. If the issue is up on the top of the chest, get in there. If the issue is kind of a flail chest here, get in through this area. If we're trying to kind of get them used to pulling that air down into the diaphragm, I'll get some tape over the abdomen, into the diaphragm. And so you use your clinical wisdom and kind of attack this in an appropriate way, however you see best. And as we see with the results here, all groups saw improvements pre and post in terms of lung function, oxygen saturation, and the ability to carry out a walk. And it didn't matter if we're talking the diaphragm or the intercostal groups. And so what you see there is that just the pre and post are all on the side of improvement on the tape, using the tape. And so if we dive into the results, on the next slide there, we see the results of this study suggest that thoracic kinesiotaping helps improve pulmonary function, oxygen saturation, and exercise capacity when given as an adjunct to standard physiotherapy treatment. However, the results suggest that there is no significant difference between the two types of taping. I mean, it's interesting that they can throw in the physiotherapy portion there, because in this study they didn't have any physiotherapy component. But I think it does highlight the fact that this is the perfect thing to adjunct to your physiotherapy, your chiropractic, your massage therapy, your any kind of body work. This is the last thing that we're going to be doing, the tape. And so this is certainly an adjunct to all the things you're already doing and takes the place of nothing that you're currently doing, I would suggest. And then the conclusion for our study here is that the findings of our study suggest that there was no significant difference in the type of taping you did. And we talked about that. The addition of thoracic kinesiotaping to the standard physiotherapy treatment protocol should be considered for better results and improved overall conditions of patients suffering from COPD. Fantastic, yeah, I think, and this can be extrapolated to any kind of lung function, any kind of lung stress, highlighting the area, reducing tension, having your brain more aware of it, decreasing the constriction through there, I think is only going to cause positive things. And as I mentioned before, there's really no downside. This is, again, the last thing we're adding into our current treatments, and it's only providing continual 24-hour-a-day level of therapy, level of improvement or care for your patients. So I chose this video here, and this is more that I would do for someone to kind of, if they had like a lower rib constriction, or if we're trying to highlight the abdominals, we're trying to highlight the obliques, we're trying to highlight the diaphragm, we're going to get tape on here, and just the proprioceptive awareness that the tape is going to provide is just going to help your patient understand how to draw that air down through the abdomen into the chest. If you're getting someone who's a chest breather and they're getting all tense up and through their scalenes and levator and upper traps, and I would certainly think about adding tape in through there as well after your treatment that you provide. And so this wouldn't be the only thing that I would do, but I think this kind of gives you an idea. Is let's get some tape over top of the areas that are tight. Let's give some tape over top of the areas that we're trying to have the brain highlight, have the brain understand what's happening at that level, and that portion of the body. And I think this is going to improve your patient's ability to be thinking about all the new mechanics that you're speaking of. If you're talking to them about diaphragmatic breathing, if you're talking to them about trying to get the lungs to the air to kind of come into the abdomen, to get the rib cage to expand, to optimize that breathing patterns. I think this is a great place to start. You could do this on both sides. It doesn't have to be just the one side, but attack the areas that you find that are tight, that you find restricted, and that you find will have the most impact from having that awareness. All right, as we conclude with our breathing function there, and we dive into here being the piece where we talk about thoracic pain, thorax pain. And so this is another recent study, and they're looking at the impact of tape on the kyphosis of elderly patients. And the interesting thing is, what we'll see here in a second, the posture of the kyphosis, as we've kind of highlighted, it is not just reserved for elderly patients anymore. It's now reserved for phone-addicted users as well. And so as we dive in, and so this is all another one of those studies which is very interesting because they had both the participants in both groups. So the two groups were a no stretch and a maximal stretch for the tape, and they had them wear the tape for 15 minutes. They would use their objective measures. They would take the tape off for an hour. They would put the other tape on, whether it was full stretch or no stretch, and then they would reevaluate. So an interesting study there where we're getting results of the same people with two different types of applications. And I will say that the no stretch is deceiving in that they had them sit in the position that they wanted to take. And so they had them in an upright posture, and then they put the tape on with no stretch. But you can appreciate that if you get going forward, then that will create stretch in the tape. And so where the no stretch tape means it's not pulling you into a different position, it certainly means as soon as you enter a different position, you are going to feel the stretch in the tape. And that entering a different position would be that kind of rounded forwardness of where the kyphosis or increased kyphosis would take you. And so it certainly is my bias, and it certainly is how I would tape, and it certainly is how Spidertech has taught about using structural taping for over a decade now, is that you are better off having the person take the position they want to take the position you want to promote, taping without stretch, and then sending them on their way, because now as soon as they get into the position that they is kind of pathological for them, they get a reminder. This is also how we're going to limit the number of skin irritations we see. Certainly that 95% of the reasons why we end up with skin irritation with kinesiology tape is because of an increased amount of stretch. And so if we're putting the tape on with no stretch, but we're getting the same benefits, then I think that's a massive win. I know as a clinician, I'd way rather have the person have a couple percentage less benefit from the tape, but not have a skin irritation. The worst thing that could happen is that the tape goes on and they go home and it irritates their skin or causes problems. That's going to do nothing but denigrate the level of therapy that I'm offering. So I think that's something to kind of keep in mind, is we always want to err on the side of less stretch, which means we're going to limit the skin irritations that we see, but also we're going to see massive improvements as long as we tape with the appropriate way, which is going to take the position that we want to take. Okay, so we dive in here. So we can see the tape that they did. They did this for both the no stretch and the max stretch groups. Really simple, and you can see that in the next, how they kind of they measured through the Cobb angle. They also measured pain level. They also measured balance and so on. And so if we kind of dive in here, and we see that, interestingly, the no stretch tape group actually did better than the stretch tape group did in terms of the Cobb angle. I would have thought that wouldn't have been the case, to be honest. I would have thought that the benefit of the stretch tape would have been that it just pulled you into this position, but that's interesting. In terms of one-legged stance, the single leg group did better, the no stretch tape did better. In terms of time from sit up and go, those timings improved as well, which again proves my bias, is that the no stretch group is going to create a more functional patient versus the stretch group is going to create someone who is more like the posture bracing type of patient where like, yes, you're stuck here, but is that functional? And I'm going to say no. I'm going to say no, it's not. And then we see that the pain level, the stretch group did have a little bit of a greater pain improvement compared to the no stretch group. The stretch group saw a 42% improvement in pain, and the stretch group saw 37% improvement in pain level. And so, I mean, but both saw excellent improvements here, both in terms of pain and function. And so, something to certainly consider. And if we kind of go back to what that tape looked like, it's just so easy to put on your patients. Like it's just something, it's the last thing you do in the treatment, and you just throw it on, and their life is better off for it. So if you look at our conclusion, both non-stretched and stretched elastic taping improved kyphotic angle and relieved back pain in elderly people, and there was no difference in the effectiveness between the groups. Applying tape, either stretched or no stretched, on the kyphotic back may improve kyphotic angle, reduce back pain, and improve balance. Reduce the sway from side to side in the short term. And as always, they suggest that they do a bigger study, which is the go-to move. All right. But it is interesting that they do get into the fall prevention, because this is something that would be very valuable, again, if we're creating a better posture for our patients in the elderly piece, our elderly populations, then like fall prevention becomes a massively important part of their life. And so it's one of those things where you can start to communicate to them. I mean, you never can prove a negative. You can't prove that they would have fallen if they didn't fall, but all these things help them kind of get it more upright. They feel more sturdy, they feel more confident, and it's going to be a benefit to their life as a whole. So how I tape for this is I'll throw 2 hip spiders on the shoulders. I find this to be the easiest way, the most effective way, and I mean, it looks the best. And so we'll get the tape on the shoulders, and I put them on there. With the hip spider, it's really simple because the number 1 piece, I'll remove that first. I'll slap it over top of right where the supraspinatus muscle is on the shoulder. I'll bring the tape down over top of the pec without stretch. And then I'll have them take anatomical position from there, so stand up straight and have their palms forward. And then I'll place the remaining pieces down over top of the thorax. You can go with a little bit of stretch, you can go with no stretch, but the reality is as soon as they roll forward into kind of flexion, that they're gonna feel that tape straighten them back up. And so this would be kind of also a go-to stretch or go-to taping application for me to help with any kind of reducing kyphosis, like creating more of an upright posture, or if we see people are hiking their shoulders up, I'll also do this type of thing to get their shoulders away from their ears. Yeah, so I think a great application there. Okay. So we'll dive into our last piece. And this is, so this study looked at axillary web syndrome, which is a condition that results from the axillary lymph nodes being removed. And as a result of that, there's fibrous tissue that's laid down. And we'll look at this study, but it also is a placeholder for just looking at the results of clogged up lymphatic system, looking at the results of when we have fluid pooling, commonly from lymph nodes being removed. And so we'll kind of dive into all that as well. So in this study, very interesting one, we looked at the effects of a manual therapy in terms of soft tissue therapy up and through the tight fibrous bands that you would expect in the axillary area. And then also, so we looked at soft tissue, we looked at tape, and then we looked at combining the two things together, which I think is fantastic. I think more studies need to do this. because that's what the reality is like in practice. You're not going to choose one and then choose the other later. We're going to combine these things. This is exactly what you would do in the practice. You would work the tissue, and then the last thing you do would be applying a tape. And so that's where I love this type of study, to kind of get the full spectrum as to the results that you can expect, because communicating the results that you expect to your patients is very important. Also, you understanding the results you expect helps you understand where they are in their improvement levels, but also if there's something else going on. If they're only getting half the results that you perceive, then maybe there's stressors going on in their life. Maybe there's something in their diet you need to look at. Maybe you didn't get as much into the tissue as you wanted. Maybe you didn't tape the right area. So having your expectations be on point, I think is a very important piece to understanding where your patients are in their rehab process. So we see what the soft tissue here is. We see what the taping application look like here. Very straightforward. But man, did we get some good results. Very interesting. In this study, they had 20 people in each group. So we had 3 groups here. It was a 4-week study, so 1-month study, and they did the treatments 2 times a week. And so in the myofascial and kinesiology tape group, we saw essentially an 80% improvement in their pain level after 4 weeks, which is fantastic. I mean, in terms of getting rid of pain from fibrous tissue buildup after a procedure and like having lymph nodes removed, it's fantastic. Group B was just the myofascial release, and again we see these like a 77% improvement, which is fantastic. And that's, again, my bias honestly would be here that group would do the best. It's like better than tape would do, just because you're getting into a fibrous tissue that is needs to be broken up, it needs to be made to resemble a healthy functioning tissue. And so that result does not surprise me. I'll be honest, the tape alone group is one that surprises me. And the results where we see these very good improvements continue in the study, but an 80% improvement in pain level from just using tape alone is very impressive. And I honestly, it shows you the power of getting tape on the skin, of having that constant feedback, rubbing on the skin, stimulating those mechanoreceptors, and what that does to allowing the body to naturally heal, get fluid out of the area, and just kind of regenerate and improve over a 4-week period. So an 80% improvement in pain and just using kinesiology tape alone is pretty fantastic. It's exceptional. And it does go to show you how the power of the human body, ability to heal itself, if you just give it the right ecosystem to do it. All right, and then another interesting thing is that not only do we see a benefit in pain, but this is just the tape group alone. We saw through ultrasound that there was a significant decrease in the thickness of the tissue, in the cord of the tissue, post-treatment compared to pre-treatment, of almost a 23% improvement or decrease in the thickness of the tissue. And also the tissue appeared more organized, so we didn't get all the fibrous tissue that kind of was going to resemble kind of like scar tissue, that we have kind of collagen everywhere and scar tissue just kind of sticking to everything. We actually saw that the tissue organized better after using tape. Again, just speaking to the amazing healing capacity of the body, given the right ecosystem to do it. I think fantastic improvements. But as you can understand, or as you would expect, adding soft tissue therapy to this would only do more impressive things as well. So for a conclusion, we see that group A, which is the tape and the soft tissue therapy, which is a combination of kinesiology tape and myofascial release, had a greater effect to alleviate the symptoms of significant decrease in pain, We saw core thickness and improvement in disorganization compared to other groups, but the other groups did fantastic on their own. This is a great study with great results. And then they made a special statement afterwards. This study discovers the effect of kinesiology tape on axillary web syndrome in decreasing pain, breakdown in fibrous tissue which formed around lymphatic vessels post-axillary dissection, and decreased thickness of lymphatic vessels that is considered as unique and primitive data. Also discovered significant effect of myofascial release technique, kinesiology taping technique, and the combination between them that can be beneficial for determining good program for axillary web syndrome. This study will help the researchers to uncover the critical areas of the histological changes in axillary cording, detecting by ultrasound with physiotherapy programs, kinesiology tape, and myofascial release that many researchers were not able to explore. Thus, a new theory on the audible pop during myofascial release technique explained by breaking down of fibrous tissue surrounding lymphatic vessels, not lymphatic itself, may be arrived at. So, an interesting piece where now they're kind of understanding that not only getting into the tissue, but adding the 24-hour, 7-day-a-week piece, which is the tape, can just further improve our benefits for people in this category, but also people who have similar type conditions. Recently, Spidertech has done a lot of work in the lymphatic drainage area, getting into the benefits of that, and so this would be one of the kind of the common areas that we'll kind of go through. This, like the abdomen, right where one of the biggest or the biggest lymph node in the body, is a common area where we get some lymphatic congestion. If we click to the next slide. And so this is a tape that we would use to help improve the function there. This lymph node is kind of the last step from all the lower body lymph coming up, and it's the last stop before we kind of get into underneath the collarbone before it drains back into circulation. And so this is going to be a common tape job that we'll use if we see any kind of puffiness, swelling in through the lower body, because as we can expect that if we had congestion through this abdomen, then the lymphatic system would drain back into the lower limbs, causing some congestion, puffiness in through there, and so this becoming an important piece. And if we kind of just highlight the other important areas as well as this, we'll get kind of under the collarbone, above the collarbone as the last stop for the lymphatic fluid to come from the head and neck down back into circulation. We get up and through the neck and jaw and cervical spine, another common area, up and through the pec, the axillary area as well being another area, and then in through the inguinal, the groin area being our second last, and then the back of the knee. Our popliteal area will be another common and important area to look at from a lymphatic standpoint. But yeah, this has become a very interesting piece. I think something to consider, kind of diving in. And if of interest, we have on our schools platform a bunch of lymphatic drainage content for education that is free for all medical practitioners. Dive in there and kind of kind of familiarize yourself with how tape can be used to stimulate the skin above our lymph nodes and promote the improved flow of the lymphatic system through the body. The abdomen being a big piece of that puzzle. All right, well, so that concludes our dive into our into our thorax patients. We covered posture, we looked at the ribs, the breathing mechanics, how posture affects pain, and also how fluid in terms of lymphatic system, but also kind of blood, inflammation, all those things can have an effect on pain, and we can help the drainage in through the thorax as well. We at Spidertech do have tape for every client. I think if the more you familiarize yourself with the school's platform, which has all of our education on there for free for you, we're trying to give you the knowledge it takes to be able to use our product. I mean, that's our thought, is that if we can provide you an easy access portal for information education that is high level, you will take in that information, and you'll understand, as I do, that Spidertech can help so many of your patients in different ways. You just have to know how it works. And so we are excited for you kind of to dive in, become a schools member with us, and to get in there. The treatment between treatments, as I mentioned, as you saw in many of these studies, is that we love when we see that tape is included within other types of therapies. Being therapists, practitioners, doctors, no one here is using tape standalone. This is usually the last piece of the puzzle. It's the finishing move, and I think that's how it's used in the most effective way. And then, because of our high-level products, your tape applications are noticeable. They stand out. They're conversation pieces for your patients with other potential patients. The visually appeasing, good-looking kind of pre-cut shapes that we have only makes your treatment look high level, look impressive, and that I know that me personally, it's a way that I generate a lot of patients, is people asking my patients what's happening there. All right, let's dive in. Let's get into our Q&A session. Hope we have lots of questions. Hope we've kind of stimulated some thoughts, and let's dive in there. Hey guys, yep. So you can drop your questions into the chat. You can actually ask your question verbally as well if you like. But any thoughts you have, kind of throw them in. We covered tons of stuff, and so let's any interesting thoughts that you have, let's chat about them. How do I? There we go. So as I mentioned before, I think the huge benefit and the differentiator between this type of structural taping for a posture standpoint, compared to like the posture braces or anything like that, is just the functionality. This doesn't prevent you from getting into any range of motion. You can go through your life, but it does give you a reminder when you are get into a position that you don't want to. So I think from a functional standpoint, this is the best posture brace that you can get, because your patients can also continue on their life, and they're not stuck in any position. They're not stuck having to take it off if they go for a swim. If they play around a golf, they can incorporate this into their life, and also into the gym, which I love having them just do the normal workout with a better posture. That seems like a great thing to do. Yeah. So we had a chat come through, a direct message, and it was, is there a recording of this? And the answer is yes. It will be, the webinar and all the previous 10 webinars are posted on the website as well on our school's platform, where you can get all of our content. But yeah, funnel through all the webinars that we have. There's tons of up-to-date research, tons of ideas, tons of how I think about treating patients within these certain areas of the body, and you can send it to people, you can review it, and it's all there for you. Also on our Instagram page is all of the videos that we went through on the webinar today. So if you want the quick hitting 20-second version of all the tape applications, they're there to give you some ideas, kind of diagnosis base, and you can kind of just save those and review when you need to. I know that's we all have busy lives, and so when we kind of want to have quick access to some ideas on how to tape it is, I would kind of use that as a reference, a good reference place as well. So I will say that next webinar, which is going to be in a month from now, webinar number 11, we're going to try a bit of a different time here. We're going to go to a 10 Eastern Standard Time slot. Hopefully that in a little bit earlier makes it easier for everyone to tune in. We've had some great turnouts. We get lots of people kind of getting to the website to review it. So. Do want your feedback. Want to know when the ideal time is for everyone here, because it's been a very exciting way to get some clinical pearls, some latest research, and some ideas out to the people we care about most, which is our medical practitioners. Don't tell the general public about that, but yeah, the medical practitioners is where we're doing our best work, arming you with content, information, and the art of application to get the best results for your patients. Thanks, Sonia. Appreciate it as well. I know everyone here has a very busy life. This is not something that's easy to tune into, so we appreciate everyone setting time aside, and we hope that this turns into using lots of tape. We hope it turns into you helping your patients out a ton, and we kind of grow and prosper together. And if anyone in here does a lot of diaphragmatic taping, chest, abdomen taping to improve lung capacity, to improve breathing function, I would love if you would throw some of that information out on our school's platform. It's set up where you can chat about it, you can post, and you can post a video or just post a description. As I said, it's one of those things that I've probably spent the least amount of time doing, and I would love some insight as to, and kind of to get that piece of taping conversation going as to how everyone's been successful in that way. So I think, yeah, a great place to start the communication about how we can kind of help our patients in terms of improving our breathing function as it becomes a massively important piece to helping our patients in terms of neck and chest pain, in terms of kind of prospering and being more efficient as a human being, as we kind of get away from hopefully this and getting towards this, and being better at everything we do in life. So jump into our school's platform, get involved there, and hopefully we can start a conversation as to how we can start taping in different ways for that as well. But I will, if that's everyone with all the questions we have, let's put a fork in it there. Thank you again for everyone for showing up. We'll be back in a month. This has been fantastic, and we appreciate everyone's time, everyone's attention, and I look forward to doing it again in January.